morning. My name is Ty Prince. I'm an allergist immunologist, president and owner of the Allergy, Asthma, and Immunology Center in East and Middle Tennessee. These are my 5 tips for starting a new business, or in our case, a new practice. First and foremost, hire the best people. Hire dedicated people who have a passion for what they do. Experience makes a big difference, but also making sure people have a passion for what they do. In the healthcare business, I think that's extremely important, that people have a passion, that they see it as more than a job, but as a service to people. And we have 3 other very experienced physicians that were already established in the area. Dr. Karthik Christian, Dr. Scout Robinson, and Dr. Nicholas Kalinsky were all established in this area and have been here for years to deliver care. And so it was simply just moving great people to new locations, but also being able to start up the electronic medical records that we used at our old practice, so we didn't have to train new employees on the EMR system. And that was a huge benefit as well. You've got to give credit where credit is due. And we have a team that helped select the practices. We have an expert in the real estate area. We had a team that came in and designed the practices. We had a team that came in and did the construction. Most of the offices were just simple remodeling, but you have to have it for a flow for allergists, which is to have an easy access allergy shot room and also good patient rooms as well too. But I absolutely could not have done this alone. I have a director that goes and meets with future employees and interviews those employees, interviewed the doctors and helped recruit the doctors that came in with the practice, and then finding once the front office, the best front office people. Again, this is the face we put on when people come in, the first impression that they get are front office people, and then nurses, not only with experience, but nurses that have had experience working with that particular physician or nurse practitioner and provider to make sure the patient gets the best care. Second thing is picking good locations to start. These are locations that were in close proximity to my previous practice, so patients would have good access and be able to have a good shot room, a good large patient rooms with sinks in each one where you can wash your hands frequently. We also have a pharmacist and pharmacy in our practice, as well as future clinical trials to be added to it. A third is you have to have a good banker and build your credit where you can borrow money to get things started. Very expensive to start a new practice or new business, period. But especially with medicine, you have to have internet connection and you have to have connectivity. And then you have to optimize that connectivity so that when people plug in allergy or the doctor's name or the practice's name, that it pulls us up quickly. We did a great job of optimizing in my old practice, but that meant we had to come in and tear down the old optimization and rebuild it. That was not easy, and it wasn't inexpensive either. If you have a known business model that you've worked with, again, I've been in practice in the Knoxville area for 31 years now, and having a good model that our local banker was convinced that would work, that made a big difference. Fourth thing is making sure you have really good connectivity with all your practices. We had to bring in a brand new EMR system. We had to have that EMR system connected to all the nurses and doctors and nurse practitioners, and have it set up to where we had emergency power. Each computer now has its own power set that'll power it for 2 or 3 days if the power runs out. And then, of course, we had to build starting with the first practice, which was this office. We had to have it, this be our base station and pay all the subscription fees and everything so that we could add on other practices. We've added on 7 other practices, one here in Maryville where we're doing this interview, the second in Knoxville at our Weisgarber office, and the third in Lenoir City for this region. And then we have 4 offices in Middle Tennessee with plans to open up offices very soon in the Tri-Cities area. So we have to be able to have good locations where patients can come to see. Being able for patients just to get on the internet and be able to pull up the practice quickly, to connect with us, to schedule appointments. They can schedule online, of course, and to have good signage and good exposure in your area where you live and where you near where patients live. When people drive by, they can quickly find your location to get to be seen. Lastly, you have to make the patient visit an experience. They have to have a good experience when they come in. We talk a lot in our practice about treating people just like you would want to be treated, your family be treated when they come in to see the doctors and nurse practitioners, and to greet those people and to make sure that they have all their questions answered, make sure we have as much data as we can for each patient and make the most data to make that diagnosis, the right diagnosis hopefully, and then the best treatment for those patients. So I think the most important thing is to have faith that you have the ability to start a business, especially if you've had experience, especially in the areas where you've been working for a long time. But knowing that if you hire good people and you work hard, that you're going to find success. I don't think it's necessary to know the level of success. Obviously, in the beginning, the level's not going to be as good, but just having a job that you're passionate about, that you get up every morning, you love to go to work, you know you're going to meet new people. So I think for those people out there that have been working for years at the same job and feel like you want to take a chance, I think it's worth it. The worst thing that can happen is you could fail and go back to where you were before, hopefully. But you just have to have the faith that it's going to work out, and that if you put a lot of work into it and you give people good service and good care, that it's going to work out. It's just a question of the degree of success, but the success, I think, is almost guaranteed in cases like this.